Brian, you're doing fine. We're at the hospital now. Relax. Calm, deep breaths for me now. There you go.
Honey, can you breathe any better? We didn't even see the beehive, or we never would have sat at that picnic table. Is he going to be all right?
I think so, ma'am. Please, step back. We've got anaphylaxis, bee sting, approximately 90 minutes ago.
Vitals?
BP is 90/60, pulse is 90 and 30, respirations are 40 and labored. We've got normal saline running wide open.
We're usually very careful. Is he going to be all right?
I think so. What's his name?
Brian Kaufman.
Brian, we're going to give you a little oxygen now to help you with your breathing. Has he ever had this kind of reaction to bee stings before?
Yes. He almost died last summer with a bee sting.
Did you have epinephrine with you this time?
Hello, I'm Dr. Susan Wynn. I'm an allergy specialist. What you just saw happens in emergency rooms across the country every day. Critically ill patients being treated for anaphylaxis. Anaphylaxis is a severe allergic reaction to a food, an insect sting, a medication, and in rare cases, even exercise. Over 50 people die from anaphylaxis every year, many of them children, many of them needlessly. During the next few minutes, we'll learn what anaphylaxis is, what causes it, what treatments are available, and most importantly, precautions you can take to avoid this life-threatening reaction. We'll also meet two people who suffered anaphylactic attacks and were prepared and knowledgeable. They survived. Now, we all know people with allergies. It seems they're always runny-nosed and red-eyed, constantly reaching for a tissue. Even though it may not seem like hay fever and anaphylaxis are related, what happens in the body actually is similar. The body's defense system is overreacting to an allergen or an irritant. Here's how it works. When someone is allergic to something, say bees for example, his body actually makes an antibody against bee venom. Now we call this special antibody IgE. This IgE coats a type of cell called a mast cell that lines the nose and lungs, skin, and digestive tract. When the bee stings and injects its venom, the venom connects two IgE molecules surrounding the mast cells. The mast cells then rupture, releasing their granules which contain histamine and other substances. These granules then burst open, releasing these substances into the body's tissues. The histamine seeks out histamine receptors in the skin, respiratory tract, blood vessels, and stomach, and attaches itself to the receptors like a lock and key. This causes plasma to leak out of the blood vessels. The tissues around the blood vessels absorb the plasma, causing swelling of the skin tissues, vocal cords, lung tissues, and even a drop in blood pressure. This reaction may happen in the nose and eyes and cause what we know as hay fever, or it may happen in the lungs and cause asthma. But when a massive release of histamine occurs and affects multiple parts of the body, that is what we call anaphylaxis. Now that we understand how an allergic reaction occurs, let's meet someone who can tell us what happened when her daughter suffered an anaphylactic reaction. This is Connie St. John and her 4-year-old daughter, Kendall. Kendall is highly allergic to fire ants. When Kendall was 2 years old, that allergy almost cost her her life.
When she got stung, she had sandals on, and the fire ants just covered her feet. And, of course, she was screaming, and we picked her up. Immediately, her feet started to swell, and she wouldn't quit crying.
Connie called their pediatrician to ask for guidance, but before she could speak to him, Kendall's symptoms got worse.
By that time, I'd say 10, maybe 15 minutes had passed. Her face started swelling. You couldn't even recognize her. And so I just told the nurse, never mind, we're on the way to the hospital.
Once at the emergency room, doctors gave Kendall a shot of epinephrine, which reversed her life-threatening reaction. Kendall was lucky. When she suffered her severe allergic reaction, her mother acted quickly and possibly saved her life. Insects aren't the only things that can cause anaphylaxis. A food allergy can be equally severe. Now, most food allergies are mild, but a small percentage of children and adults with food allergy may have anaphylaxis. Those who also have asthma are especially at risk. So, what do you do if you are severely allergic to a particular food? You may be careful not to have that food in your own home, but what do you do if you eat out? Menus are enticing to read, but they don't list every ingredient in every dish. If you're allergic to, say, eggs, and the restaurant you're dining at uses eggs in its Caesar salad, choosing the wrong salad or restaurant could leave you seriously ill. It may only take a taste. Let's hear Elizabeth's story now. 1-year-old Elizabeth Pinion was having Christmas breakfast with her relatives in a restaurant when one of them gave her a few bites of scrambled eggs. He didn't know she was allergic to eggs.
Her eyes began to swell, and her tongue, her lips, her whole body. It was just like I was filling her up with air.
But Elizabeth's mother was prepared. She knew Elizabeth was allergic to eggs and had a shot of epinephrine in her purse.
So we gave her the epinephrine shot immediately in the thigh, just as directed, and within a matter of 2 minutes, she was a different child totally. It was like nothing had ever happened before. You could just see the air or the swelling leaving her, the hives. It was like a magic show. She was just coming back to her old self.
Elizabeth is 3 now, and Carol Pinion is emphatic that wherever Elizabeth goes, epinephrine must be available. While the majority of anaphylaxis cases outside of a healthcare facility are caused by food and insects, medication or exercise can cause anaphylaxis as well. Penicillin, seizure medications, allergy shots, muscle relaxants, and even aspirin can incite a violent reaction. It's imperative that any doctor or hospital treating you knows what medications cause a reaction in you. Now, doctors have known for a long time that strenuous exercise can make people with asthma cough and wheeze, but now we know that exercise can cause anaphylaxis too. Exercise-induced anaphylaxis is very rare and very puzzling. It doesn't happen every time the person exercises. There may be a relationship with warm temperatures or with a particular food having been eaten earlier that day. What happens during an anaphylactic reaction? The main areas affected during anaphylaxis are the lungs, cardiovascular system, skin, and digestive tract. Respiratory symptoms can begin with violent sneezing, runny nose, and watery eyes. Wheezing and tightness in the lungs is also common, especially in those who already suffer from asthma. The most serious of respiratory reactions during anaphylaxis is swelling in the throat. Many who have died from anaphylaxis died because their breathing tube literally swelled shut. Severe reaction in the skin can range from feeling itchy all over to massive swelling of the skin itself. If it's a food allergy, itching in the throat may be the first sign. Digestive tract symptoms include nausea, vomiting, abdominal cramps, or diarrhea. Reactions involving the heart include feeling faint, which may mean low blood pressure, shock, and an irregular heartbeat. Anaphylaxis often develops within minutes, and unfortunately, death can occur quickly. In a small percentage of patients with anaphylaxis, a return of symptoms develops several hours later. This is when a number of deaths can occur. The symptoms are similar to the initial episode, so even if your initial allergic reaction begins to fade, you still need to seek medical attention immediately. And you must assume once you've had an anaphylactic reaction to something, you always will. Even minimal exposure to the allergen can cause anaphylaxis, like the traces of peanut butter that might be left in the jelly jar. More than 4 out of every 1,000 people stung by an insect will have a severe allergic reaction. Insects that can cause an anaphylactic reaction usually include those with stingers and wings: honeybees, wasps, yellow jackets, and hornets. And in the south, even fire ants, like we saw with little Kendall earlier. It's important to remember that insect stings can occur at any time of year, even in cold weather. Food allergy in general is more common than insect allergy. It is estimated that up to 7 children out of 100 are allergic to a food. Now, while the vast majority of these allergies are mild, some are anaphylactic and can be fatal. The foods most likely to cause anaphylaxis are common foods such as peanuts, eggs, wheat, milk, and fish. Shellfish like shrimp and lobster are also common causes of severe allergic reactions. Almost any medicine can cause an allergic reaction, but 2 common types of medications that can cause anaphylaxis are antibiotics and even aspirin. Now that we know what causes anaphylaxis and the symptoms to look for, let's review the treatments available. Allergic reactions that are limited only to the skin, like itching, a rash, or slight swelling, may be treated with antihistamines alone. Liquid antihistamines are more rapidly absorbed. Now, these are available without a doctor's prescription and are very safe, although they can cause drowsiness. Now, if the allergic reaction involves anything beyond the skin, for example, the lungs or the digestive tract, an injection of epinephrine needs to be administered immediately. This is the most important treatment of anaphylaxis. Epinephrine can reverse virtually all of the body's anaphylactic reaction within minutes. Epinephrine can save your life. Everyone who has had an anaphylactic reaction should have epinephrine on hand. However, epinephrine is only available with a doctor's prescription and needs to be kept at room temperature. Now, in a hospital or a doctor's office, a standard injection would be the way to get the medicine into your bloodstream. But what happens if you're nowhere near a doctor and you're stung by a bee or eat the wrong food? Your doctor can teach you how to give epinephrine to yourself or your child. Don't panic at this thought. It's really not hard, and there are different ways to do it. One option is the EpiPen. The EpiPen is a unique auto-injector which has a single pre-measured dose of 0.3 milligrams of epinephrine in a pen-sized cartridge. The needle is recessed in the barrel and operates on a pressure-activated spring-loaded system. You don't have to learn how to fill a syringe or give a shot. All you have to do is remove the safety cap and firmly press the tip of the cartridge on the outer thigh. The needle then pops out, injecting the epinephrine automatically. Leave it in for a few seconds to allow all of the medication to stream in. The advantage of the EpiPen is that just about everyone can learn to use the spring-loaded syringe. You don't have to learn how to give an injection. Other traditional methods include the Anakit or Anagard, which contains a preloaded conventional syringe with 1 cc of epinephrine. The syringe is specially made to administer multiple injections. If necessary, the syringe can be reused. This system also recommends the chewing of several antihistamine tablets also present in the kit. You can learn how to give an injection of epinephrine just like the nurses do, using this standard 1 cc syringe and a small bottle of epinephrine which can be obtained from your pharmacy. It's obviously not very handy to carry a bottle and a syringe around with you. Also, properly using a syringe may be a bit inconvenient and difficult in a life or death situation. Stinging insect allergy can be treated. Skin testing to stinging insects, when performed by a board-certified allergist experienced in this area, is safe and reliable. Once the allergist has determined which insect is the culprit, she can start the patient on venom immunotherapy, a series of allergy shots which have a success rate of 95%. The best prevention of anaphylaxis is to not come in contact with what causes your allergic reactions. Common sense can prevent many stings. Those with a history of stinging insect allergy should avoid smelling sweet. Avoid bright-colored clothes and perfumes. Outdoor garbage cans should be covered. Do not go outside barefoot, and if at all possible, exterminate in your yard and other areas where you and stinging insects could be sharing time and space. The best treatment for food anaphylaxis is also prevention. First of all, people with food allergies should never eat alone. Keep a keen eye out for the food you're allergic to, and don't be afraid to ask questions about the food you are being served, either in someone else's home or in a restaurant. Are there any eggs in the bread? What kind of nuts are in this cookie? Is this a milk or water-based recipe? These are not prying or rude questions. They are life and death questions that need detailed answers. When in doubt, don't eat the food in question. For example, if you're allergic to peanuts, assume all nuts are peanuts unless told otherwise. If you are allergic to certain medications, your doctor should already know this. If you change doctors, it is vital that you inform him or her of any drug allergies. It is also important to carry medication allergy information on your person at all times. During an emergency situation, you may not be able to speak for yourself, so let your allergies be known through a piece of paper in your wallet or a medic alert bracelet. If you have anaphylactic reactions to a food, insect, medication, or exercise, be prepared. Always carry epinephrine with you. Have it where you can get to it quickly and know how to administer it to yourself. Carry epinephrine with you always. If you're allergic to insects, make sure you have it when working or playing outdoors. If you're allergic to food, be sure to have it with you when you eat away from home. Children with anaphylaxis should have epinephrine at school or daycare as well as at home. Anaphylaxis can happen within minutes and is intense. For the child or adolescent in school or daycare, thorough written communication is a must. Everyone who works with the child must be aware of the risk of anaphylaxis, know how to recognize the early symptoms, and have a treatment plan agreed upon in advance. Cafeteria personnel especially need to be aware of food allergies. Epinephrine and perhaps antihistamines should be readily available if a reaction occurs. Of course, you'll have to follow local regulations about keeping medications at school, but the best plan is to have the older child or adolescent carry their own epinephrine and give it to themselves when they have a reaction. Almost everyone who uses epinephrine will become shaky and their heart will pound. Don't worry, it won't last long. Epinephrine can be used by almost everybody. However, if you have heart disease, thyroid problems, are on medication to treat depression, or are pregnant, discuss this with your doctor first. Learn how to use the EpiPen properly to avoid accidental injection into a fingertip. Yes, anaphylaxis is frightening, but if you work with your doctor and know how to avoid what you're allergic to and how to treat a reaction immediately, you don't have to live in fear. I'm Dr. Susan Wynn.
Did you have epinephrine with you this time?
Yes, we did. I administered it myself. It's the first time we've had to use it. Is it helping at all?
Oh, it sure is. His breathing is easier. His blood pressure's normal. Brian, are you feeling better? I want you to try to sit up now. There you go, nice and easy. Good. You're going to be fine.